Welcome to the Naturopathic Perspective, a show that we created to help get the community some more information about naturopathic medicine, Chinese medicine, and nutritional medicine. Today, we've got a show on mental illness. I'm your host. My name is Andrew Alshouse. I'm a student at Bastyr University. So Dr. Kristen Allott is a naturopathic doctor who graduated from Bastyr University. She focuses her practice in treating people with mental illnesses that are on medications and dermatology as well.
Thank you, Andy. I'm really excited about the show because there's a lot of people here in Seattle who have little exposure or knowledge of naturopathic medicine or acupuncture.
Do you use any nutritional medicine in your practice?
That's the basis of a lot of the medicine that I use with my clients or patients, because a lot of the people who come to see me have been referred by mental health professionals, and they're on a lot of psychotropic medication or medication to control anxiety or depression, and I have to be very careful to work around their meds. And so by using nutrition as the base of the medicine, I can help heal the systems of the body that have been influencing the mental health problem so that they're not as dependent on medications.
What about traditional Chinese medicine? Do you practice that?
I do practice traditional Chinese medicine, and how it plays in terms of treating anxiety, depression, addictions, post-traumatic stress disorder is if you've been in that state for a while, you forget that life can be better. And what I find with traditional Chinese medicine is people often get off the table and they feel better today. And that's the point of how I treat them, is so that they feel better today. And sometimes they'll feel better for 2 or 3 days. I have one client who's better for 21 days to the dot.
Then how do you approach your general patient with a mental illness like depression or seasonal affective disorder?
Well, first I take a thorough history. Usually when I meet with them, the appointment is for 50 minutes, and we spend the whole time talking about their symptoms so that I can get an idea of the underlying physiology that is driving their suffering. And so then I sometimes order lab work and do physical exam, looking not only at a traditional physical exam, but there are other subtle physical exams, both from the Chinese perspective as well as the naturopathic perspective, that gives me an idea of what's driving their individual biochemistry and physiology that's making them so uncomfortable. And then we come up with a plan, a blueprint of short-term and long-term goals. We kind of lay out the blueprint, and then I see them fairly quickly in every week or every other week for maybe 3 or 4 more appointments. And then they have enough structure in which to not see me as frequently, and then they start sort of a check-in basis. Again, it depends on the individual, but generally when someone initially comes to see me, because I'm a cash practice, I like to give them an idea of the initial time that we're going to spend together so that they have an idea of what that will be.
Okay. And what do you mean by a cash practice? What is that exactly?
Cash practice, I'm not on insurance plans, primarily because insurance plans won't pay me for what I do. They would underpay me or not pay me at all, or because I'm working with people with mental health issues, they won't pay for mental health issues. So I've chosen to be a cash practice. I have a very small office with low overhead in order to keep it affordable. I also offer classes on nutrition to increase energy and mental clarity through nutrition, which is more affordable for people who can't come to see me on an individual basis.
And where exactly is your practice?
It's at 89th and Aurora in Seattle. Monday through Fridays, usually from 10 until 7.
What kinds of medications then do you work with most?
Most people come in on an antidepressant or an SSRI, such as Paxil, Effexor, Prozac. Those are some of the common. I also have patients who are on Depakote, which is a fairly common medication often associated with manic depressive, but I have patients who are on that who aren't formally diagnosed. Sleeping agents, such as trazodone, are the primary ones that I see.
How do you then see the insomnia or the anxiety? How do you approach that?
I approach it by addressing the individual issues. For instance, a lot of anxiety that I see is augmented by hypoglycemia. So as I explain to my patients, if you're hypoglycemic and you have anxiety issues, for instance, if you didn't have enough protein for breakfast and you had a lot of sugar for breakfast, by 10 o'clock you're going to be fairly hypoglycemic. And then if your boss comes and yells at you, you already have adrenaline in the system because you're hypoglycemic, and then your boss yells at you, and you can all but not have a panic attack. By eating more protein for breakfast, a lot of my patients, instead of having anxiety levels of 9 or 10 out of 10, simply by making some dietary changes and also adding some supplements, they'll lower their anxiety to 5 or 6 out of 10, which is manageable. Most of my clients are seeing mental health professionals, and they still need to continue to address the mental health issue or what's causing the anxiety, the emotional component to that. But by getting control of the physiology, they're better able to manage their anxiety and depression.
Well, were you inspired to work with this population?
Before coming to Bastyr, I worked with kids in psychiatric crisis, which was an amazing experience. One of the things that I noticed is that the kids who were eating fairly clean diets and not a lot of sugar were better able to control their moods and their anger issues. For adolescents who had been dismissed from school setting, these young men who didn't have a lot of emotional control anyway were the ones who were actually getting restrained, which was unfortunate, and it was very much driven by their diet. When we stopped giving them so much sugar, they were better able to control their behavior.
Mm-hmm. When you work with a patient and you help them try to increase their protein in the mornings and help them figure out a diet, what do you do to help them make these changes?
I make set small achievable goals. And so that requires a lot of discussion with me and my patient on what's achievable in their lives. I had one patient who she referred to herself as a box eater. So everything was lean cuisine, came out of a box, which was really good news because then we could see what her carbohydrates, fats, and proteins were. It was very easy to figure out. And she was very clear that she was going to stay a box eater. And I was like, okay, you're a box eater, so let's figure out how to make this a successful technique of yours. And so we would dialogue about that, and she would go get some more information about different food types. And we had to supplement a little, but she could continue to eat out of boxes, which as a naturopath isn't the ideal, but I would rather work with the achievable than the ideal.
What is the theory essentially behind your treatment? What cause of this disease that you address?
Well, often the cause is on the emotional plane. And I'm not a skilled therapist, and so it's important that they're seeing a skilled therapist to address the initial cause. May it have been abuse, neglect. I think it's very important that they're addressing that because from my perspective, which is a neurological perspective, by addressing that, it's allowing the forum of the neurons in their head to reorganize themselves to get out of the pattern that they're in. My job is to simply provide the constituents or the nutrients in which to allow the plasticity of the brain to happen, as well as the physiology behind that, which gets very complicated, but in a simple manner, that's my goal.
We're going to have a few students ask a few more questions. I'd like to introduce Hillary, Will, Brandy, and Ben.
Hello, Dr. Allott. I'm Hillary, and I'm a third-year medical student practicing naturopathic, hopefully practicing naturopathic medicine. And I just have a question for you regarding mental health. And I was just wondering what the naturopathic perspective of mental health is compared to conventional medicine.